another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Alycia Kluegl to speak on optimal fitness during childbearing years. Alycia Kluegl is an exercise physiologist, health and fitness consultant, and owner of Empower Your Body Wellness. At Empower Your Body, they offer programs, products, services, and tools which embrace accountability and best facilitate empowerment of one's health, life, and fitness-related goals. Alycia's experience ranges from working in corporate fitness at Medifit, Novartis and Johnson Johnson to cardiac rehab at Mountainside Hospital and Hackensack University Medical Center. She also helped devise the plan still in use at New York sports clubs on how to best educate new fitness employees. In 2002, Alycia started Empower Your Body Wellness. Since then, she has been featured in many local and national publications such as Shape, Self, and Marie Claire, as well as the best-selling book, Buff Brides. Alycia has also taken part in many workshops and lectures at several Fortune 500 companies and local groups, as well as created Empower Your Body TV, which can be seen online in over 2 million homes in the tri-state area. For more information, please check out her website at empoweryourbody.com. Welcome, Alycia, to the call. I'm so excited to have you on the podcast today.
Thank you, Laura. Me too.
So today, Alycia and I are going to focus on the topic optimal fitness during childbearing years, and Alycia has so much research and information that she's excited to share with us about the importance and the benefits of really being physically fit prior to getting pregnant, during pregnancy, and also, recovering your body after giving birth. So I'd love to start off, Alycia, with you just sharing with our audience a little bit about who you are, your personal story of why you chose to become an exercise physiologist and a personal trainer.
Sure. So my name is Alycia Kluegl. I'm an exercise physiologist, and I own Empower Your Body Wellness. And the reason I decided to get into the field is, if you listen to my mom, she says I was born running. I didn't even walk. I ran. So basically, I've always been active, always enjoyed the body, always been fascinated by the body. And I just felt it was a natural fit for me to become educated in a field where I could have professionalism and knowledge to be able to help people as much as I can. So becoming an exercise physiologist felt better to me and more thorough because I didn't want to just be a trainer. I wanted to actually have a lot of science under my belt, and I wanted to be able to work in all different areas, cardiac rehab, in hospitals and corporate fitness, and helped a lot of companies grow their corporate fitness departments. But then I just said I want to start my own business. So my story is all about trying to improve the overall wellness of humanity. I want to be able to help whomever I can, as much as I can, and I use the science of the body as a platform to do that.
Mm-hmm. That's awesome. I love that. And I've known you for, over 10 years now. And it's been such a pleasure to know you and to witness your passion for your mission, that you just
Thank you. Awesome.
So, yeah, it's very clear. It emanates from every cell in your body that this is something you're very passionate about.
You have that too, Laura. You have that too.
Thank you. Thank you.
You're welcome.
And, as you're speaking, I realize that maybe some of our listeners are not familiar with what an exercise physiologist is and what the training entails. So do you mind just spending a couple minutes talking about that?
Of course. So an exercise physiologist, you get a degree. So I went to college for 4.5 years and got my degree in exercise physiology. And what it is it basically allows you to do 3 different things. The first would be personal training, which there are very reputable certifications out there. I'd probably say 4 or 5 are pretty good, very good. And then there's about 300 that I would prefer people become they're not as good. But when you go to school for physical exercise physiology, you could become a personal trainer. You could do corporate fitness. So, you can work in different companies and run their whole corporate fitness department. It's basically running the gym in that in that company. And therefore it helps the company decrease in insurance payments, and it just keeps productivity high and morale and camaraderie high, because fit people are always, fit people have usually more energy. And when a company focuses and allows the opportunity for their employees to be fit, they appreciate that. So you could do that. And then you can also do something which I think is so fascinating, and I did a lot of this, is cardiac rehab. So you can work in hospitals with cardiologists and basically help rehab patients' heart, cardiovascular, cardiorespiratory systems back to health after any sort of heart surgery. So you can monitor their exercise programs, and you really learn as an exercise physiologist the importance of the science behind progression and intensity and mode and frequency when it comes to prescribing an exercise program. It's not just, you want to lose weight, sure, this is what you have to do. The science behind it is so much more in depth, and I found that to be so rewarding and really helps me a lot. But personal training, I do, and I have people who do that with me as well, and it just allows you to have so much more knowledge under your belt.
Right. That makes a lot of sense, and I think that's really important for women listening to this, that, when you are looking to hire a personal trainer, you really want to do your research and make sure the person is qualified. Can you give the recommendations of the programs or the certifications that you can recommend?
Sure. Well, I always have to say that I really suggest people work with exercise physiologists. That's first.
Okay. How would they find an exercise physiologist in their area if they're not in the New Jersey area?
Yeah, good question. Unfortunately, there's no licensing for exercise physiology. So it's not like you can go to a website and find licensed exercise physiologists in your area. Unfortunately, that just doesn't exist. How do you find one? You just do your research. And if someone is an exercise physiologist, they're going to say that. So you can just basically Google in your area looking for exercise physiologists. Another place that you can go to is your local hospital, because you will find exercise physiologists working in the hospital. And then they can always refer you out to maybe someone that they know, or a lot of hospitals have gyms now affiliated with them, and you're more likely to find someone thoroughly educated at those locations. So that's first. The certifications that I think are good, there is the American College of Sports Medicine, ACSM. ACSM focuses a lot on clinical. So if you're really looking to the science of clinically improving your cardiorespiratory, cardiovascular health and fitness to a cellular level, that's what ACSM teaches. So you're really going to find somebody who's thoroughly educated in the science and the clinical aspect. That is the one that I think is very important, especially if someone is of poor health or has a lot of contraindications. Then I really suggest seeking a trainer who has a certification in that. Another one is the National Academy of Sports Medicine, NASM. That one I think is great as an athlete. If you're an athlete and you're really looking to improve your performance, NASM focuses on the importance of how your ankle affects your neck. And you would know this too in your field. So how the ankle affects the knee and therefore affects the back. And it really focuses a lot on core work. So NASM is for an athlete or a person who really wants to improve their performance of their body. Someone certified in that is going to be well educated. Another one is ACE, the American Council on Exercise. That one kind of broadly touches a little bit of those two I just said. It's a good one, but I really lean more towards the first two that I mentioned. So if you want clinical, working with the heart, you go ACSM. If you're more of an athlete, looking to see how your whole body can work together as one kinetic chain or one unit, I suggest NASM.
Awesome. I think that was really helpful because, people listening to this podcast are living all over. So this will be great information for them, because it is important when you're working and hiring a trainer that they are very knowledgeable in how the body works and anatomy and physiology, and that you're going to be safe. So
yes, I completely agree.
Okay, great. So now, our main topic today is we wanted to focus on getting our bodies ready for pregnancy, and then how to maintain that physical fitness during the pregnancy to help create a better birth outcome, and then how to recover that fitness after giving birth. So let's start off with prior to conception. Tell us a little bit about the importance of exercise.
Sure. So, of course, I'm going to say that it's important to be fit all the time, I think, right? We want to have a strong body. And when you are about to, or you want to get pregnant, a lot of studies show that if you exercise before, it actually increases your chance of becoming pregnant. Now, we want to say everything is moderate, right? We always want to balance. Too much exercise can actually mess with everything as well, right? So we want the moderate amount of exercise does show that you have more of a chance of actually conceiving. In addition to that, moderate exercise shows to increase your insulin sensitivity, so that when you do become pregnant, you decrease your chance of acquiring gestational diabetes. So it's really important to be active. In addition to that, you actually have a increased chance of not gaining as much weight when you're pregnant. So basically, the more active you are, I take that back. I'm sorry. Moderate amount of exercise has been shown to decrease your chance of gaining too much weight during pregnancy. Fit people before they're pregnant usually maintain their fitness during pregnancy, and you won't gain as much weight. It also decreases your chance of preeclampsia during pregnancy or high blood pressure, and that's very important. Excuse me?
I completely agree. Continue.
Yes, okay. And also, this is really important. I tell all of my clients, and I have heard this from numerous doctors that I've associated with, that when you become pregnant, the general rule of thumb is you can continue whatever exercises you were doing prior to being pregnant, as long as you're not high risk. So a woman who was exercising prior to becoming pregnant can usually maintain that same level of exercise, but it's usually, you have to be really careful when you can't really start exercise when you're pregnant unless you are monitored by your doctor and you're really careful. So of course you can, when you get pregnant, start exercising, but it's best to be active before, so then you just it's a smooth ride right into it.
Yeah, and it's also a safer ride as well. So I'm so glad you pointed that out. Can you clarify what you mean by moderate exercise? Because I think that is an important point. If a woman is over-exercising, then it's going to impact her menstrual cycle, and that can definitely impact her ovulation and being able to get pregnant. So what do you mean by that?
Right. Sure. So a lot of this depends on the individual, right? Because some people can handle more intensity than others. But basically, you want to be active about 3 to 5 days a week with multi-joint exercises, meaning you don't just want to isolate one thing, just multi-joint exercises, squats, push-ups. Again, this is saying that this person can do all of these exercises because they'd have to go through an assessment. But just multi-joint exercises. And you want to say cardiovascularly, when we talk moderate, anywhere between 70 and 85% of their maximum for their workload, for their cardiac output. So, it's not the time, moderate exercise. Some people can do spin and they feel okay. And other people are doing yoga and they feel okay. So it's just, as long as you are not coming out of balance, right? So you don't want to be fatigued all the time. You want exercise to empower you and to give you energy, basically.
That's right. Yeah. So that makes sense. It could be a little bit different for everybody, but I think the point here is it's not working out 7 days a week. I don't think that's probably recommended for anyone. Your body needs a day off. It needs time to rest and repair and recover. And it is also a whole body workouts, so that you're mixing it up. And I guess one day you may not work the whole body, but you're making sure to alternate over that week period to hit the different major muscle groups.
Right, and if I may say something, it's also about your kinetic chain, keeping your kinetic chain strong. So you want to do exercise. You want to have a strong core prior to going into being pregnant so that you have more stability, you decrease back pain, and it's very important for posture because your center of gravity is going to be changing. So you want to try to be as fit. I tell my clients this all the time because what happens is that this is what I have seen happen. Someone will say, oh, I need to work out. I'm getting married. Okay, great. We get you in the best shape of your life. I'm telling you, don't stop exercising because you're going to try to have a baby soon. And then they go on their honeymoon, and then they slack off a little bit, and then they're like, oh, wait, now I have to get into good shape again because I'm going to get pregnant. I want to get pregnant. So the key is really to never have that slack. Just be fit. Use your body, sleep well, drink water, eat healthy, eat balanced, and stay strong.
Those are words to live by.
That's awesome.
That's great. Yeah. So, I mean, it makes sense. So, I mean, the ideal situation is be in a really, and I mean, we even talked about this in other podcast episodes about detoxing and, making lifestyle changes prior to getting pregnant because that's going to actually help with getting pregnant, but also help with having a healthy pregnancy, which you've already touched on. So now let's say a woman is pregnant. Let's talk about, and let's say she was active and fit and, in a good place getting pregnant. What type of exercises is she doing during that pregnancy? Is there any changes between the first, second, or third trimester? What do you recommend?
Sure. Sure. Okay. So we're taking a woman who's been active prior to pregnancy, and she's now pregnant, and we want to make sure she's not high risk. High risk is always a little bit more touchy, but if we have a healthy woman, not high risk, the best exercises that I do, I kind of keep it simple. So in the first trimester, I find that a lot of clients have less energy.
Yeah.
Their energy just goes way down. So my approach to them is to kind of just try to get their energy back up. And that's not, I repeat, that is not by super fatiguing them at all. So you want to just get them moving, get a little bit of endorphins flowing so that they're feeling good. Make sure that we don't lose the gains that we gained cardiovascularly by working their heart. But we just might keep it just a little bit lower with intensity. So we want to make sure to keep their energy up. We want to make sure to get the endorphins flowing. Want to make sure to keep their heart or their motor, their engine running. Want to make sure that we're careful about stretching as well, because during your pregnancy is when relaxin is released, and that's going to increase the elasticity of soft tissue. So we really don't want to overstretch because that's a problem. I've seen things happen with people, and it can be dangerous. So you want to be careful not to overly stretch things. You want to keep the core strong, so a lot of stability ball work. And we also want to make sure that we keep their metabolic rate elevated, because if we do so, it's also going to make things a lot easier afterwards when they give birth. So going into the second trimester, usually they're finding their rhythm. They're pregnant now. They're getting more comfortable with it. And easy for me to say. I've never been pregnant. But they're getting more comfortable with it. And then we can kind of like knock up the intensity a little bit more. And that's what I try to do.
Too.
Yes, exactly. So that's when we take advantage of that. And then that's like the meat of the workout. And then in the third trimester too, that's when they gain. Some clients, they could gain most weight because the baby's really growing at that trimester. And then they start to lose their energy again. They get more fatigued. So at that point, it's like, okay, we're close to the finish line. Let's just keep the core strong, work on the stability ball, just do some range of motion exercises with your hips. So it's really just a matter of working with the client, but you want to keep their core strong, engine running, and muscles feeling strong too.
Yeah, that's so important. That's good advice to have. And,
thank you.
Can you talk a little bit about, before we even get into exercising after giving birth, let's talk about getting ready for that birth. Like, what are some of the best things a woman can do at the end of her pregnancy that we're going to actually help her have an easier labor and delivery?
Sure. Okay. So if I'm understanding what you're saying is how do we keep the body strong, or what can the client or woman do to help birth easier?
Yeah,
as easy as
birth
possible,
is a very
right?
musculoskeletal event, right? It's involving the pelvic floor and the basin, all of that. So that's all impacted by physical fitness and muscle flexibility as well as strength. And I think that's the other thing that we want to talk about is, strong muscles are not tight muscles, right? So if the pelvic floor is very tight and constricted, it may appear to be strong, but it's actually weak, and it's going to be harder to give birth. So how can a woman actually really help prepare her body for the event of labor?
Sure. I'm understanding. So first of all, when you're pregnant and you're exercising, it really helps with anxiety. So I have found with some women and clients that when they're pregnant, a lot of them get nervous and get scared. I mean, basically, your whole life is changing, your body's changing, what is going to happen? Right. So exercise really helps decrease that anxiety. And when you decrease anxiety, you're going to decrease overall muscle tension. Yeah. So decreasing muscle tension is one way of basically allowing your body to relax. And a woman's body will go with the flow of what it has to do. I mean, it's been doing it forever, right? So if you can stay calm and get a woman to decrease her anxiety, a lot of times what happens is muscle tension decreases, then we'll have more ability and more mobility to do what we need to do. Keeping the body strong, also keeping the pelvic floor strong, you could do breathing exercises where you just compress and contract isometrically, contract the muscle without motion, the lower muscle in the abdomen, the transverse abdominis muscle. So you can just balance work is really important to be able to keep those pelvic floor muscles. The Kegel exercises are also very good to do. And so balance, any kind of stability ball work, moving your arms and your legs independently. Again, all of this is, depends on the woman. But keeping the muscle strong, so working on stability balls, doing balance work, doing breathing exercises. And I've also, in the 2012 study, read that when you're fit while you're pregnant, you actually have a decreased chance of having an unplanned C-section. Yes. Right. So a lot of women go in, they say, I'm going all natural, right? Right. So, when staying fit is going to give you confidence, and then you're going to affect your mind and your soul, and that's going to affect your body as well. So I think I'm answering your question. Tell me if I'm not. But with exercises, a lot of pelvic floor. Go ahead. Yeah, and I was going to say, I'm so glad you brought up that study because, if we think about it, birth is such a, like I said, a musculoskeletal event, like running a marathon and more. And you need a physically fit body in order to accomplish and move through that process without interventions. And we find that interventions lead to unplanned C-sections. So being able to avoid or minimize interventions during birth will directly impact that the ability to have a vaginal delivery. What about, if a woman is wanting to have an unmedicated vaginal delivery, we know a lot of it during labor, you want to be walking and standing and being upright to use gravity to help assist with the baby moving down the birth canal. What about squats, like having strong, leg muscles to help hold you up while you're laboring? Right. So there are many different specific exercises that you can do that will actually help with labor and delivery. Any sort of those pelvic floor exercises like we just mentioned. Another is squats, because how interesting is this? When you're doing squats, especially while you're pregnant, I have clients that are a week from birth and they're doing squats. And what you do is you're actually stretching the skin that you actually decrease your chance of ripping or tearing. Yeah. So, right. So like that. It's true. So it's true. So when you're stretching, when you're squatting, you're actually getting the skin near the vagina, that you're going to actually be stretching it so that it has less of a chance of tearing it. So squatting is very, very important. Also, exercises that you could do in yoga are very important. Yoga actually can help get you in touch with your body. So it kind of connects your mind and your soul and your body, so you're more likely to be able to breathe through, to be calm, and to be present and not be as fearful or scared. Mm-hmm. Another one is interval training. Interval training really helps cardiovascularly, so it's like a pumping effect. So you get your heart elevated, you bring it down a little bit. You get your heart elevated, you bring it down a little bit. And the way we do that is I'll have clients do like 2 or 3 minutes on an elliptical machine, come off, do 10 squats, then come off and balance only on your right leg doing rows. Rows are really important for posture during pregnancy because the weight of the belly is going to pull you forward. So rows, anything to strengthen your upper back will help. Another exercise that's very helpful is we call it the cat-cow, right? I'm sure you're familiar with this, right? You go on all fours and you just bring your belly, you arch your back so your belly goes closer to the floor, and then you exhale and you pull it up kind of like a cat would round their back. And what that does is just helps with breathing and helps to strengthen your pelvic floor muscles, specifically that transverse abdominis muscle. And in addition to that, you just get some mobility in your hips and in your back. So there are many things that you could do depending on the person, but I find that those are very helpful.
Mm-hmm. Yeah, and they're all gentle. You know, another one that I like to recommend is like a belly dancing type of figure 8 movement. So like at the end of the pregnancy when you're preparing for birth, you can hold a chair and you can just gently move your hips into a figure 8 to help open and get the baby, you know, moving downwards and opening. It's all about opening up that pelvis, which is so important during birth.
And you could do that also, Laura. I have clients do it sitting on a stability ball. They'll keep their legs wide open, and we just do that motion rocking back and forth in the figure 8 with their hips.
Yes, and in general, sitting on one of those balls, an exercise ball, a birthing ball, stability ball, those are, I think, in general, that's a good thing for all women to do towards the end of their pregnancy instead of sitting on a chair, because it's just helping to open up, which is what we want at the those last few weeks of pregnancy. So that's a really good, that's something that every woman should have at her house to be sitting on, whether she's watching TV or reading a book or, you know, anything like that, instead of just sitting on the hard chair. So,
and anytime that I'm sorry, Laura, go ahead.
Go ahead.
Anytime that there's a lack of stability, you're going to be working your core muscles. So sitting on a ball, I mean, this is good for people in rehab or people in general, but specifically women who are pregnant, when you sit on a stability ball, you're lacking stability. So whenever there's no stability, you're going to be engaging your core muscles more. So it is a very helpful tool to use.
Right, because we want that strong core that's going to be used so much during the birth process. Definitely.
Right, which is called labor.
That's right. So now let's say a woman has given birth, and there's a couple options here. Ideally we could cover both. Let's say a woman was fit, had, an unmedicated delivery, and now she's looking, once she gets the approval from her doctor to return to exercise, she is looking to get her body back, so to speak, her pre-pregnancy weight and so on. But also let's talk about a woman who potentially had a cesarean delivery, and she's going to have a different type of recovery after birth, or a woman who has a diastasis where she has some separation in her abdominal wall and also needs to rehab that. So there's a couple different women that, could be presented here after giving birth. Can we talk about their fitness?
Of course.
Yeah.
Absolutely. So let's take the woman who basically has the separation of the abdominal wall, right? First of all, every woman you can't begin exercising until your doctor gives your clearance, right? As you mentioned. So that can be anywhere between 4 to 8 weeks, right? On average, 6 weeks. But I've also had clients who they've seen their doctors give their approval in 3 weeks. It goes according to your mood, how you feel, because you're not going to be sleeping as much, but a little bit of exercise, and again, it's all individual to the person. But with the separation of the abdominal wall, they also have these, which I'm not always a fan of products, but there is like this little belt or wrap that some doctors prescribe for their patients to be able to keep that closed, kind of like a butterfly stitch, right? One of those Band-Aids, right? And that could be helpful. You want to be really careful with a woman who has these splitting of the abdominal wall, because they can really get hurt, and you can, as an exercise professional, hinder their progress of moving forward. So you really want to make sure that you start things real light with intensity. I would just stick with the breathing exercises, and again, stability, working from the inside out. And I really wouldn't be doing any sort of crunches or sit-ups. Those should be totally contraindicated. And just working on improving mood, getting the heart to be strong. But you really want to just be real careful with that person, and they want to be in touch with their doctor. And a woman who had a C-section, the recovery in the core is going to be a little bit longer, because you've actually cut through muscles and so forth. So the healing of that will take longer. But the good thing is that a fit, healthy woman heals faster.
Right.
So as long as you're fit and healthy prior, you have a lot of increased chance of healing. In addition to that, again, you want to make sure that you're keeping her safe. I've had women work through C-sections afterwards, and they're okay. You just have to be careful with them. What kind of specific exercises? Again, you might be able to get into light crunches like in a couple of months, but you always want to work deep to superficial. So you want to work that transverse muscle with stability still, and breathing exercises. A woman who had a natural birth with no medication, then she's basically ready to go as soon as the doctor says go. And it comes down to a comfort. So again, I'm always going to stick with core. I'm always going to stick with making sure the motor or the heart is working well. And then we can gradually start to work on increasing the metabolic rate with the muscles. I've also found that women, after they give birth and they breastfeed, lose weight. Yeah. So a lot of their weight just comes right off. That increases your metabolic rate really high. Right. So it's more about working with the person and making sure that they're comfortable, they're safe, and making sure that what you prescribe to them as an exercise plan is making them feel better, not more fatigued.
Right. And so it might be kind of a gradual thing. I mean, I'm glad you also pointed out, like, even if a woman, physically is recovering pretty well after giving birth, she is still going to probably be sleep deprived and not, going to be as full of energy because of the sleep deprivation, and then just in general the stress of taking care of a newborn. So, exercise can help, but it can also, it's going to be modified, right? It needs to be a little more gentle, and it's kind of a gradual ramping up.
Right, and you also don't want to have especially when you're breastfeeding, you don't want to have these really super intense workouts, because you're going to be releasing lactic acid into your body and your bloodstream. So when you are breastfeeding, you want to be cautious of what you're giving your baby. So there's really no need to go real intense, and again, it's all varied on the individual, but that's why you want to make sure you're drinking plenty of water too, because you don't want those toxins being released at such high levels.
Right, and just making sure to not get dehydrated, because nursing can also, you need more water intake in general, and then if you're sweating with the exercise, that extra water is very important. Yeah.
Right.
Okay, good. So you've covered all of the different stages, and is there any other information you want to share regarding this topic?
Yes, there is, actually. Thank you for asking. So, first of all, this is really important. I tell my clients that when you are fit and strong prior to becoming pregnant, your chances are much greater of maintaining your strength and your health and fitness and endurance into pregnancy, which therefore allows you to have more endurance to endure the active labor, right? This makes sense, okay?
Yep.
But what's interesting is that when you exercise during pregnancy, you have a more increased chance of your baby having a lower BMI, even into adulthood. And this is so fascinating to me, I think. One of the studies I was reading was that when you exercise during pregnancy, it shows a link between women who are active during pregnancy and their babies, which when they become adults into old age, have a decreased chance of acquiring Alzheimer's. Isn't that amazing?
Yeah, makes sense.
So
cool, though.
Fascinating.
That there's a science to show that. I mean, it really does make sense. I mean, I love, too, that you mentioned, people that exercise in general also have better moods, right? It really helps to impact the emotional state of all of us, right? And that's so important during pregnancy, because if you are feeling happier in general, your mood is improved during pregnancy, that will impact the biochemistry that you are passing along to your baby as well. So this is, I would think that this would even potentially impact postpartum depression. I don't know if you've done any studies on that, but because we're talking about how exercise improves mood, it seems like that would be helpful. And these are all things that can be done. This is all very proactive, and even you can be preventive, right? So it's not just treating after the fact. Yeah.
No, and Laura, we're talking all about like science and, exercises and everything specific. What it really comes down to, I have found, and I've worked with so many pregnant women in the last 20 years, is that women see their body changing, their hormones are changing, their mood is changing, and a lot of them get irritable and not happy, right? Because they're like, what is happening to my body? I'm gaining weight. What is this? And just the simple fact of exercise helps to improve body image. And when you improve body image, it's going to help the way you're thinking about going through this 9-month activity of being pregnant. So when you're active and when you exercise and when you're eating right, not only are you feeling better, mind, body, and soul, but you are passing that to your baby. Your baby has a greater chance of growing up healthier, decreasing chances of acquiring diabetes as an adult. I find that fascinating.
Yeah.
That what you do when what you do when your baby is growing and how you eat is going to affect them as an adult. I just think that's absolutely fabulous.
It is, and it is the truth, and it makes sense. I think it's common sense. It makes sense since we know through epigenetics we have control over the genes that are passed along to our children. And I also, I was thinking about this, and then you briefly just touched on it. When you are staying fit and you're exercising regularly, you make different decisions on what you put in your mouth. So you are going to probably actually even eat more nutritious, healthy foods, which is obviously so vital preconception through pregnancy and beyond, even nursing. The food that you put in your body is going to impact your health and your baby's health. So I love that you were able to that's definitely a part of this too, and it's going to impact how healthy you are during the pregnancy and how healthy your baby is as well.
Yes, and I find that new moms, well, not new moms, right, but women who are in the first trimester, I have seen this numerous times. Some women say, oh, I'm pregnant. I can eat whatever I want right now. And it's my kind of green card to just do whatever I want to do. And, I don't care. I'm allowed to do this. I've spent the last couple of years, not eating bad, and I'm going to eat bad. But the problem with that is, and I've seen it, it affects their mood. They gain so much more weight, and then things hurt, their feet hurt, their back hurts. So it just makes no sense to me. I would rather that woman view their body as a temple, right?
Yes.
And which is housing this new little creation. And that's not the time to just say, I can eat whatever I want. It's the total opposite.
Oh,
and then find that women, and women who go through this first, then their second child, when they become pregnant, they're like, oh, I remember that. I'm not doing that again, meaning eating poorly.
Right.
Right. So I'm going to do this right.
Create medical issues with gestational diabetes and preeclampsia. Both are related to excess weight gain during the pregnancy, which is usually like over 25 or 30 pounds. If you're gaining that over the entire pregnancy, you're at risk for those health issues. That creates a high-risk pregnancy, and a high-risk pregnancy is going to definitely lead to it could lead to a different type of birth outcome. So it's definitely something that can really be avoided based on these basic lifestyle modifications of exercise and nutrition. It's like really
decisions.
Basic. Yeah.
Right? You're making decisions, and your whole mission is I think one of your missions is to promote how you can have a healthy, natural birth. So you do that by treating your body properly. And if you treat your body properly and you listen to, the advice, there are, medical things that need to be done. But if you do that and you have a positive outlook, and that's affected by the food you eat, how you view your body, you need to have a good support system. I mean, I could go on and on. But the idea is that you want to have this whole little system working well, right? And if you have this whole little system working well, you increase your chances.
Totally. So I love it. Thank you. I love that you're able to really share this. You shared the science, the research, and it's really also you're sharing this common sense. Like, it just makes sense that, when you're looking at making a baby, like, this is the time to really make all of the positive lifestyle changes that are possible to really optimize the ability to get pregnant, to have a healthy pregnancy, to feel good during your pregnancy, have a good birth outcome, and have a quicker healing after giving birth. So these are all so important, and it was great for you to be able to share that with us. So I just really appreciate that. And your contact, I know, is empoweryourbody.com. If somebody is living in Hudson County or northern New Jersey area and they want to work with you directly, they can contact you through your website. And is there anything else?
And I also have I have people who work for me, so they can travel as well. So, we can go outside of Hudson and Bergen County.
Oh, okay. What other areas do you cover?
Well, New York City.
Okay.
It's Central and South Jersey as well. So basically, New York City. I mean, some people go into the boroughs, so kind of keep it New York City, and as well as the majority of New Jersey.
Awesome. Well, that's great to know. So if you're living in that area, definitely reach out to Alycia through her website, empoweryourbody.com. If not, take her advice to heart. Find, I think in general, I'm just a huge fan of having a trainer to help coach you regarding physical fitness. And so, I mean, of course, women could do these exercises on their own, but if you're finding it's hard, if you're not feeling the motivation, then either going to an exercise class or having a one-on-one trainer can be highly valuable to keep you accountable and help support you through that process, and also to make sure, to your point, that you're doing the exercises safely and to help prevent any injuries.
Right, and if I can add something, please. So this is what I find one of the benefits is as well as working with someone. First is that they're going to educate you on how to do things properly. But you can be given a program, because some people just want a program, and I'll prescribe a program to them after assessing them. But the thing is, when you're working with someone on the spot, they make changes. So my brain is constantly like a flow chart. So here we go, here you are, you're performing this because this is what you need to do, but let's see, now I'm seeing a little bit of internal rotation in your knee, or I'm seeing something affect your shoulder. So now we got to change it to this. So a qualified and educated and thorough fitness professional can actually change things right on the spot to make sure that whole time that you have with them is being used so effectively and efficiently.
Yeah, that's such a valid point. So it is really worth investing in when we're talking about your health, the health of your baby, and having the best outcome. So,
it's a necessity, not a luxury.
Exactly. Thanks again for coming on Well-Adjusted Mama, sharing your passion for fitness, and
Thank you.
I really appreciate it.
You're very, very welcome, Laura. Thank you very much.